My name is Kimberly Fine. This is my poster on the association between early prescribed opioid initiation and risk of suicidal behavior. Suicide is the second leading cause of death for young people, and young people are being prescribed opioids at increasing rates. However, there's little research examining the relationship between prescribed opioids and suicidal behavior. So we investigated this relationship and showed young people's risk of suicidal behavior increased after taking prescribed opioids, though the risk diminished after controlling for confounding. These findings highlight the importance of using different designs to control for confounding, as the relative rates of suicidal behavior varied across the designs. We used Swedish population-based healthcare data to compare young people on risk of new onset suicidal behavior after initiating prescribed opioids. We looked at children, adolescents, and young adults with no history of suicidal behavior and at least 1.5 years of no opioid prescriptions. We used 3 designs to compare opioid-exposed people, the turquoise color in the plot, with an unexposed person matched on demographics, with their unexposed siblings, or to people prescribed NSAIDs. And each of those comparison groups is the peach color in the plot. The demographically matched and the sibling comparison designs were our weaker confounder adjustments, and results from those designs show that people prescribed opioids are at roughly triple and double the incidence of suicidal behavior, respectively. Our strongest design was the NSAID comparator, which adjusted for factors shared across pain indication. And results from this design show that those prescribed opioids are at only roughly 15% greater incidence of suicidal behavior. Results from the NSAID comparator design suggest the relationship between suicidal behavior and opioids was mostly due to the underlying pain indication shared by people prescribed pain medications. Our results highlight the importance of clinicians monitoring young patients who are prescribed opioids for suicide risk, and that young people prescribed opioids for pain may benefit from ongoing suicide assessments.